All right, let's dive into a part of your body you use constantly but probably never, ever think about: your neck. It's home to this incredible hidden world of muscles, all working for you every single second. I mean, really think about it for a second. You nod yes, you turn your head to look at something, you swallow your coffee. It's all just automatic, right? But how? What is actually going on under the skin to make all of that happen so seamlessly? Well, that's what we're going to do right now. We're going to peel back the layers and take a look at the powerful, precise, and totally amazing muscular orchestra that conducts every single one of those movements. Okay, so our journey starts on the surface with the most obvious muscle in the neck. This one is a huge landmark. It's going to be our guide. In fact, if you turn your head to the side, you can probably feel it pop out. This big guy is called the sternomastoid. It's this long strap-like muscle that actually has two starting points, or heads. One starts at your sternum, your breastbone, and the other starts at your clavicle, which is just your collarbone. From there, they both travel up your neck and attach to that bony lump you can feel right behind your ear. Now, here's what's so cool about how this muscle works. If just one side decides to contract, it'll tilt your head to that same side, but it turns your face to the opposite side. Kind of tricky, right? But what happens when both sides contract at the same time? Well, they pull your head forward and flex your neck. You know, the exact move you make when you're looking down at your phone. This muscle is so significant, it's so massive, that anatomists actually use it as a boundary line. It neatly cuts the side of the neck into two distinct zones. You've got the anterior triangle in the front and the posterior triangle in the back. It's literally the great divider of the neck's landscape. Okay, so we've got our landmark down. Now let's go a layer deeper, to a truly one-of-a-kind bone and the super intricate muscle system that controls it. This, folks, is where the anatomy of the neck gets really, really interesting. So I want you to meet the hyoid bone. It's this small, U-shaped bone that just kind of hangs out above your voice box. And it has this incredible claim to fame. It's the only bone in the entire human body that doesn't connect directly to any other bone. So how does it stay there? Well, it's suspended in this web of muscles and ligaments, acting like a floating anchor in your throat. Now, attached to this floating anchor, you've got two teams of muscles playing tug-of-war. First up, we have the suprahyoid muscles. These guys are located above the hyoid bone. Let's just call them the lifters. Their main gig is to pull that hyoid bone upward, which is an absolutely essential move for swallowing. And you know, for every action, there's gotta be an opposite reaction. So below the hyoid, we find the infrahyoid muscles. These are all strap-like muscles, and they do the exact opposite of the lifters. These are the depressors, and their job is to pull the hyoid bone right back down after you're done swallowing. Let's go even deeper. We're going right down to the muscles that are basically hugging your spine. These are the deep, foundational muscles providing all the core stability for your entire neck and head. Running right down the front of your vertebrae are the prevertebral muscles. Think of them as the frontline defense, the core stabilizers for your spine. They create this muscular sheet that gives you that deep, essential support and allows you to, tuck your chin to your chest. Then, over on the sides of the vertebrae, we've got a group of three muscles called the scalenes. And these are a perfect example of how muscles can be amazing multitaskers. On one hand, yeah, they help you bend your neck to the side. But get this, they have a totally different job too. They actually help lift your top two ribs whenever you take a really deep breath. Okay, for our final stop, we're looking at the deepest group of all. This is the highly coordinated, finely tuned machinery that powers one of the most complex things we do all day: swallowing. You see, swallowing isn't just one simple action. It's a perfectly timed two-step dance. First, you have the lift. A set of three muscles pulls the entire voice box and throat structure up. Then, immediately after, in this beautiful coordinated wave, the constrictor muscles perform the squeeze, contracting from top to bottom to push food down towards your stomach. It's just an incredible feat of biological engineering. So as we wrap up our little tour here, let's just pull all these different layers and functions back together. We started right on the surface with that great divider, the sternomastoid, and we traveled all the way down to the deepest, most intricate muscles of the pharynx. And what we've seen is that dozens of these individual muscles, each with its own specific job, have to work in perfect harmony. It really is a symphony of movement, enabling everything from a simple head turn to swallowing your lunch. And that kind of brings me to a final thought for you. The next time you just take a simple sip of water, maybe you'll pause for just a split second. Maybe you'll appreciate that silent, hidden orchestra in your neck, flawlessly conducting the whole performance. Thanks for joining me on this tour.